Doctors of Reddit, what is your most heartbreaking diagnosis? Dentist here. 18-year-old kid needed either dentures or $30K for a full mouth of crowns. He had genetic enamel hypoplasia leading to soft enamel and his teeth had eroded to little nubs. When I presented this info to him and his parents, they laughed at the idea of spending that much on his teeth and said, "Well, looks like we are letting them fall out and getting you dentures later." He seemed genuinely distraught. I felt pretty sad about the case, so I called them a few days later offering to do the case as charity and I would charge nothing. They said they would consider it, but never called me back. I tried following up and they didn't return my calls. This was a year ago and I think about it a lot. Hey doc. I've always wanted to ask a dentist this. Why does a mouth full of crowns cost $30,000? I had an extraction and simultaneous implant done with an industry standard implant for $1,000 in Colombia at a clean, well-staffed dentist. They were doing all on fours for $15,000, I believe. What is being lost in translation where the price point here in the US is up 50 to 100%? An all on four costs less than a full mouth reconstruction. I also do all on fours for around $15K. If you have 28 teeth that all need $1,500 crowns, that adds up really quick. It's more labor intensive too. An all on four takes me 2 hours max. A full mouth of crowns can take greater than 8 hours. My dad is an oncologist. He told me about a woman who declined treatment because her husband threatened to leave her if she lost her hair. He was the only family she had and she didn't want to lose him. My dad tried to reason with her. He asked if he could talk to her husband, who didn't come to the few appointments she attended. But she refused and disappeared for about 6 months. Then she came back because she had begun to physically decline and her husband had left her. She wanted treatment, since she had nothing left to lose at that point. But the disease was too far gone and she didn't make it. She was 25. That's definitely one of the more devastating and infuriating stories he's told me. Edit. Arguably the worst part is that this isn't as isolated an incident as you might think. The whole reason my dad told me the story is because someone told a very similar story on Reddit. I mentioned it to my dad and I said, "I think it must be fake though, no one is that evil." Which is when he told me he'd seen it before, and more than once. Not a doctor, but an occupational therapist, had a patient who was clinically diagnosed with a stroke, no MRI, given medication, sent home with family to check on him, and I saw him a few days later. He seemed worse than the report from the hospital, but I gave him some advice around managing his fatigue and helped him with a few tasks in the house, making a cup of tea, folding laundry. That was Friday. Monday I called to check in and he's doing worse, has moved to his brother's home where someone can be with him 24/7. I go visit him on Tuesday at his brother's house and he's freezing in the middle of sentences, not able to take his hat off without multiple stops and starts. His brother had to feed him his breakfast. This is not a stroke. I send him back to the emergency room and he's readmitted to the hospital. Within a few days he's not able to speak at all, within 2 weeks he's gone. Took a month to get the final diagnosis back from the lab. CJD. Losing someone to CJD is brutal. Wouldn't wish that on my worst enemy. Bacteriology lab tech here. Anytime we get word of a CSF with potential CJD incoming, you can feel tension in the air. It's easily at the top of our do not F around with this specimen list. Pa-Tau syndrome. There's a group of genetic defects called trisomies in where people have extra chromosomes. Most people are familiar with trisomy 21, Down syndrome. But there are others like trisomy 18, Edwards, and trisomy 13, Pa-Tau. Children born with Pa-Tau syndrome don't have much hope of surviving for too long even with medical treatment. Longest I've seen was barely over 2 months in the neonatal, newborn, ICU. There's been reported cases in where the patient lives for as long as 19 years of age, but those are very rare. In most countries people are given the choice to abort these babies to save everyone from the prolonged pain and heartache. Abortion is illegal in my country though, so I get to see the mom try her best to bring to term a baby with a death sentence. Junior on an ed ward. My boss gives me an easy case to start off for a man who comes in with a headache and slow speech. I learned the man recently had his daughter die from cancer. Boss thinks it's depression. Examining him, something is definitely off. I order a CT scan thinking it could be a stroke. Brain cancer. Dead within 1 year, leaving behind his wife and 18-year-old son. Life is precious. His wife lost a child and husband. How do you even come back from that? I used to be a dispatcher for a large college university. Just before Christmas, a student was in a horrible car crash and was placed on life support in the university hospital. His family was told to come quickly to say goodbye, as he didn't have much time left. The grandparents got there first and were waiting in the hospital room with their grandchild. Unfortunately, while the parents were rushing to the hospital, they lost control of their car on an ice patch. They crashed the car and were both pronounced dead at the scene. So I dispatched the officer to notify the grandparents, who were attending to their dying grandchild, that their son and daughter-in-law were just killed. Even the notifying officer wasn't okay for a few days after that. It's awful, but shit like that happens. I do a lot of trauma, and telling parents that their kid died due to stupid decisions is no fun. Lately we had a lot of kids die from climbing on top of trains and getting electrocuted, so please stop doing that. I read a lot of police reports for several years in my job. And this is something we instilled in our kid. There is stupid stuff. And there is stupid, deadly dangerous stuff. Climbing trains, jumping from bridges, running over the Autobahn is the latter. I think we came through, and he never ever even thinks about doing stuff like that. Dementia is underrated. Your loved one is unrecognizable when it gets advanced. Think guilt/grief/frustration/indignance all rolled into one. The worst. My grandmother had to be reminded every day that she was indeed sick. She knew something was wrong, but could never remember why. Eventually, and this is my last memory of her, she just gave up and would be found staring at the ceiling completely blank-slated. Not moving, not talking, just waiting for it all to end. Doc came and gave her a morphine drip, let her fall asleep, and that was her final nap. I'll never forget visiting her during that last year, and when I walked in at 32 years old she said, "Hey baby, where you been? You still living with your mom?" I hadn't lived with my mom since I was 2 years old. Not a doctor but ex-surgical tech. First wave of COVID shut down all non-essential surgery including cancer cases. I specialized in gynonc. We finally got the approval to do this surgery on a 70 years old female. Unfortunately, the case had been postponed for so long due to COVID that we learned 10 minutes into surgery that this lady was terminal. If we had been able to do the surgery 6 weeks earlier, she would have had a chance. Never understood why cancer was not deemed essential. I lost a lot of patience. We were given staggered surgical time for priority cases during COVID, and having to justify cancer cases to administration who do not have any medical training just for 90 minutes of surgical time will never not piss me off. Thankfully, since I've been in the medical field for the last decade of my life, I am able to compartmentalize it. But I'll admit there's times where the memories of people I've treated pop up. Amyotrophic lateral sclerosis, ALS, is quite shit. My mom died of it last year. It's a horrendous disease. Their brain is still there and functional, but at the end they lose all motor function. Heartbreaking was when my genetic test came back positive for the mutation that leads to ALS. I work on Huntington's alongside a consultant neurologist. He said the most heartbreaking thing he ever had to do was wipe away another man's tears after informing him he had ALS because he didn't have the ability to do it himself anymore. I do genetic testing for the gene expansion that causes Huntington's, and writing a positive report for someone who is not yet clinically affected feels exactly like signing a death sentence. There are no current treatments, but some promising work is being done on expansion modifier genes. Hopefully we will have something ready to go soon that can at least slow it down. Locked-in syndrome. The only times I've seen it, the patient can only blink/cry, and have to listen to the family argue about if/when/how to let them pass. I think about it often. Long-time work comp attorney here. I agree that locked-in syndrome is the worst disability I have encountered. That also held true for the guys I worked with at the time that file was on my desk. Not a doctor, but an ER nurse. I absolutely hate when we find cancer in someone who comes in due to some vague symptoms. Whether it be blood in the urine that turns into bladder cancer, difficulty urinating that turns into prostate cancer, or we do a belly CT and see nodules on the lungs. The worst part is we don't know 100% if this mass/spot is cancer. We can just tell you about it and have you follow up. I can't imagine the stress waiting to know for sure/how bad it is. My worst was a woman in her early 30s who had just beat breast cancer. She was a widow with no kids, and her only parent had recently died of ovarian cancer. Saw her for abdominal pain, and on the CT found an ovarian mass. When we told her, she just looked so alone and devastated. I am not a hugger, but she was definitely my longest hugs to a patient in my career. My literal only symptom was being itchy all over my body. It was stage 4 lymphoma. I'm fine now, but yeah, cancer is effed up. TLDR, most patients in the pediatric oncology ward really I remember my first time on that ward about half a year into my internship. I was tasked with putting an IV access in and then to take a blood sample from this young and long-time patient of that ward, like many pediatric oncology patients there, to send to the lab to get new blood to transfuse for her. To preface, putting an IV access is already much harder on kids than it is for adults, and if the kids are cachectic, super young and their veins have been poked at for years and years for treatment, then that task gets exponentially difficult. At that point I was used to kids who would cry and tear the room down when they even glanced at a needle. This ward was different. Me being more or less a very green/fresh doctor at the time must have seemed to be noticeably anxious because this patient looked me dead in the eyes and in the calmest manner said, "Doc, don't worry. I'm not gonna fight you. This is just my life. Get it over with." She took the stick to her vein emotionless, then went right back to scrolling through on her iPad. That was when I understood her words, that normal life for them included getting needle sticks from unfamiliar doctors and nurses, hospital beds, having to hear other babies cry all day every day. All doctors get desensitized to some degree, it's part of the job. But to know that those kids get numb to all this truly broke something in my heart. I once treated someone who went in for an abdominal surgery but during the procedure lost blood supply to their spine. They woke up, permanently, paralyzed below chest level. Hi, can I ask, is that something that should have been prevented on the table or it is just a very unfortunate happening? Sorry if that answer should be obvious or something. I was a student at the time. Unfortunately I didn't know at the time and never found out. But even now years later and working in rehab with older adults and geriatrics, we see a lot of post-surgery complications that weren't able to be prevented or foreseen at the time and then they impact people for the rest of their lives. And there's not always definite answers about what happened or why. In general, the older we get the more risky any surgery can be. 19-year-old female had a complete removal of her uterus, TAHBSO, because of an aggressive cancer. She died on the table. I was a gynonc right now. I remember one case long ago of a young woman patient that had been trying to get pregnant and started feeling swelling in her abdomen. She started getting positive pregnancy tests. She thought she was pregnant but was distrustful of medical professionals and never sought prenatal care. Presented after collapsing, and had T-spine fractures due to mets. She also had liver mets. The ovarian tumor along with the ascites made her look 40 weeks pregnant. I remember her husband shaving her head because we were starting chemo. Just heartbreaking. I don't recall the exact type of cancer but I believe it was a yolk sac tumor. Another case was a choriocarcinoma after the birth of a healthy child. Normally gestational trophoblastic disease happens with a molar pregnancy but this patient had just had a baby a few months before diagnosis. She ended up passing in the hospital after a stroke. 60-something retired nurse presented with rapidly progressive cognitive changes and odd movements. Workup revealed she had Creutzfeldt-Jakob disease. She was with it enough to understand the diagnosis and simply cried to her husband saying, "I'm sorry for what I'm about to put you through." She discharged on hospice and passed after a few weeks. 30 years old female came in with some mild difficulty walking and sensory deficits in her legs. We MRI her brain and spine to see these ovoid-enhancing lesions in her brainstem and cervical spine. She had recently emigrated from an underdeveloped country, making us think this was an odd presentation of an infection like tuberculosis. We performed a lumbar puncture and don't see any signs of infection or inflammation, so we have to enlist the help of neuroinfectious disease experts from other institutions to no avail. Over the 2 to 3 weeks she was in the hospital, she goes from walking the halls to a quadriplegic. Eventually one of the lesions expands to a point where we can reasonably safely biopsy it. The biopsy comes back as glioblastoma. These types of tumors rarely present in the spine and brainstem, and there's nothing we can do to help her. She discharged home on hospice and died a couple weeks later. I remember how my son's doctor couldn't properly speak while informing me of his leukemia diagnosis. He was his doctor since the day of his birth. My son was 9 then. It turned out to be AML. He beat it twice before sepsis took him from us in 2022. I'm so sorry for the loss of your son. I lost my stepson to cystic fibrosis. His mom died of it too, when he was a bub. It's a hole that never heals. I've been in a similar situation to your doctor, telling someone I cared about that someone they loved has died. I had to do it via phone for the speed factor, so they don't find out via social media. I remember my knees giving out, I'm kneeling in the middle of the road, and the tears just cascading down my face but also being so furious because my damned voice wouldn't work when I really needed it to. Grief is so physical. I am so sorry. Here's an additional layer from the physician perspective that most people don't realize. The nicer and more wonderful the patient is, the more likely their diagnosis is severe and devastating. There's no rationale behind this, nor am I aware of any data that supports this, but just about every single physician agrees with this experience. I've noticed this in life in general. The more full of life, love and just general happiness a person is, the less time they get. The bitter ones who hate life get to experience it the longest. My personal experience. 15 years old kid. Had a headache and stuffy nose for a couple days. Mother thought he was trying to get out of school. Day 4 or 5, he was drowsy and not easily rousable, so presented to hospital. Intracranial extension of sinusitis. Subdural empyema. Dural venous sinus thrombosis and evolving venous infarct. Large craniectomy to wash out the empyema and allow expansion. Developed large intraparenchymal hemorrhage following surgery. Next day the empyema started collecting again, even with the open skull and drains in situ. More infarcts, now including in posterior fossa structures. A few days later, developed contralateral empyema. Second large craniectomy. More swelling. More infarcts. Life support was withdrawn a few days after that. I think he went from healthy to dead in 2 to 3 weeks. I checked what the lab cultured, I can't remember them right now, but the kid had organisms I've never heard of. Real left field shit. Given how septic he was, they probably couldn't even use his organs. Really sad case. Would you mind putting this in layman's terms for those of us outwit medicine? And thank you for the work you do. I had the same question, and ChatGPT gave me this. A sinus infection spread into the brain. This caused a collection of pus under the brain's outer covering, subdural empyema, and clots in the brain's veins, leading to areas of brain damage, venous infarct. A large part of the skull was removed to clean out the pus and allow the brain to swell without being compressed. After the surgery, there was significant bleeding inside the brain. The next day, pus started to gather again, even though the skull was still open and drains were in place. More areas of the brain were damaged, including parts at the back of the brain. A few days later, pus collected on the opposite side of the brain. Another large part of the skull was removed to clean out the pus again. There was more brain swelling and more areas of damage. Thank you. But also, that's awful. For a kid as well. My friend is prone to sinus infections and that's scary to think about. I sometimes forget when I'm not speaking to medical folks. Talking in jargon helps to keep things separate. ChatGPT got it pretty correct. Also, he was intubated and anesthetized the first day. To my knowledge, they never woke him up. Recently had a lady show up to the hospital with 6 months of a cough and unintentional weight loss. She knew something was wrong, but had been putting it off while trying to care for her husband who was undergoing chemo for stage 4 lung cancer. CT scan showed horribly advanced cancer everywhere: lung, lymph nodes, bones, liver, etc. Absolutely gut-wrenching conversation. Probably won't ever forget that one. I'm a high-risk obstetrics doctor. When I was a resident, we had a pregnant woman brought in by ambulance found down in a pool of blood. She was about 36 years old, first pregnancy, about 32 weeks along, husband traveling for work. She had been on the phone with him and he said she stated she didn't feel right. Then he heard a crash, and she wouldn't respond. When she got to the hospital, the medics had the Lucas CPR machine going on her and she was white as a sheet. Put the ultrasound on and saw a baby in an agonal heart rhythm, last stages before fetal death. Did a stat perimortem C-section right there in the trauma bay. First bloodless surgery I ever did, with the heart not pumping. People don't bleed in surgery. Got baby out, it went to the NICU on cooling protocol but kept seizing due to anoxic brain injury. They withdrew care within hours. Kept working on mom, but never got her back. Pronounced her after about 45 minutes when the husband got there about 5 hours later, had to tell him about his wife and baby. I've never heard someone sound like that, just complete despair. You could hear the brokenness in his screams. I was a new dad at the time. It took me a while to get over that one. I work in rural medicine now, but prior to that was in hematology. Clinical and lab. So many a shitty leukemia diagnosis. Plenty of young and old dead adults. But perhaps one of the most heartbreaking things I had to do was when I worked in the lab. I got a call in the middle of the night from one of our scientists with a blood sample they'd received from a rural doctor and had arrived quite late. From a 5-year-old, I think. But when it went through the machine it had some worrying counts, so the scientist had to look at it in the middle of the night rather than in the morning. They were concerned enough to get me to take a look and emailed me a bunch of photos taken of the slides. Absolutely raging leukemia. Cancerous cell counts massive. Normal cell counts absolutely tanked. High risk of them just spontaneously bleeding in their gut or brain. Something that had to be dealt with right now. But the doctor who requested the bloods couldn't be contacted. So I tried to call the parents, as this kid needs to not just be in hospital ASAP, they need transfusions and to be on a plane to fly about 1,000 kilometers to a specialized pediatrician hospital ASAP. Alas, I couldn't get the parents on the phone either. So, I called their local ambulance. I sent them at about 1 a.m. to go bash on their door until someone answers and take that kid to the local hospital. In the meantime, I'd be arranging their medical flight to the city. Got all the people along that chain on board. All of that went as smoothly as one could hope. But it broke my heart to think how traumatic that would have been for that family. It's bad enough to learn your kid has such a terrible disease, but to learn by red and blue lights and someone bashing on your door at 1 a.m. Edit, just to add, since quite a few have asked. The kid got to hospital, transfused safely, which we had to get sent over from another town, and air transported to the city safely. I didn't get any further communication beyond there other than some of the additional tests I requested that night. The kind of leukemia they had is very aggressive, but the survival rates with modern treatment are very high, 90% plus at 5 years. So they likely did well. They'd probably be finished their treatment around now. I changed a part, as I recall now. I didn't go into work, I did that from my mother-in-law's home office. The scientist emailed me a horde of photos of the film. Downside of that is we only get paid for call-ins, not calls to us at home, so it meant I was up for hours in the middle of the night for no pay. But that's the life. Not a doctor. But I occasionally looked after an airline pilot in his 20s, who had come for a tumor removal. Complete success, caught early. Was told he'd be in hospital for the weekend, home Monday. Alas, he got an MRSA infection, and the overworked weekend doctor didn't check his fever out. Monday rounds caught the fever, they started IV antibiotics immediately. Alas, it left him unable to move anything but his eyes. His mother worked to make up a communication sheet she left on his pillow. He had maybe 40 words made up, he could use to chat to you. I used to take 15 or 20 minutes to chat to him the odd time, at work. Obviously very one way, but he could ask questions, if you told the story like a choose your own adventure. Just remember his mother caught me chatting one day, and bought me a fistful of lottery cards as a weird, thank you. I haven't thought of that in many years. Not a doctor, just a personal story. My sister-in-law had been diagnosed with synovial sarcoma about 6 years ago. She had been going through chemo for some time and had been getting lots of blood transfusions because she would get bloody noses that wouldn't stop. One trip to the hospital late at night, the doctor had apparently misread the file or didn't read the correct one, but when he saw the blood test results for white blood cell count and ran a couple more tests, he came in to tell her she had cancer. She got a good laugh and told him she's known for a minute. The initial reaction he had was great, pure shock when she started laughing. The somber look he had coming in and then the laugh he got when she laughed was good. She lived for another 3 years before she passed. It's been sad watching my brother cope, and I don't know how to help. But he's come a long way and is doing well. During my time in the ER, I had a patient with metastasized prostate cancer come in with a severe headache. A CT scan revealed he had a brain bleed due to the metastases, and he likely had only a few days left. When I told him, he teared up and said he was supposed to get married in 2 weeks. So that night, another doctor and I decided to organize a wedding in the hospital. We got an officiant for the next day. His fiancée arrived that night. I remember them sitting together, holding hands, and watching the stars through the emergency room window. She spent the night in the bed next to him and they held hands all night. They got married the next day, surrounded by a few friends and hospital staff. 2 weeks later, he passed away, married to the love of his life. I still get teary-eyed when I think about it. It was such a bittersweet moment and one of the most memorable patient encounters I've had.